Now, unless you've been living under a rock for the last couple of months, you'll know that the news is consumed by the outbreak of this new coronavirus. And last week we saw the passing away of Dr. Li Wenliang, the doctor who first raised the alarm bell surrounding this mystery virus that he was noticing in his patients. Dr. Li Wenliang, now a hero to so many people in Wuhan region of China where he lived, who was an ophthalmologist, first noticed these strange cases in a handful of his own patients. And in recent weeks there's also been news of another doctor, Dr Wang Guangfa, who's a respiratory surgeon that contracted the coronavirus but fortunately recovered, and he's been warning that he believes that the coronavirus is being spread through the eyes. So we've got two medical professionals that both contracted the coronavirus. One has sadly passed away and the other one fortunately has recovered, and he continues to warn people that he believes that the eye is a vulnerable area that is leading to the continued spread of this new novel coronavirus. So is it just a mere coincidence, or is it in fact an important health advice that we should be emphasizing in the advice that we give to people? I'm Martin Oguzie and this is Martin's Eye Tips. Thank you for joining me. I'm a UK based optometrist where I've been in practice now for about 20 years, and on this channel we're all about helping you see better, see more comfortably and be less anxious about your eyes. So today's video is going to be more of a brief explanation around the news event and how it relates to the eyes, and therefore I'm not going to be explaining what the coronavirus is or anything like that. There's plenty of information about that, and in fact I'm going to link in the description box below some important information about it from the World Health Organization, as well as the NHS and UK government information as well, if you want to read upon some of the facts around the coronavirus, exactly what it is and what you should be doing to protect yourself. So for this video I'm going to be jumping behind the computer screen where I've got some articles that I really want to show you, so we're going to do that right now. Okay, so here we are behind the screen, and this is the first article that I want to show you. It's from an article dated the 6th of February by the Post Online Media magazine, and at this point Dr. Li is still critically ill, and this article gives a little bit of a breakdown of really the story of how he came about to discover the condition, how he got sick, and you know, there are some key things here that I wanted to just highlight, and I'll leave a link to this article in the description box below so you can have a look for yourself. Dr. Li Wenliang was working as an ophthalmologist, so an eye surgeon at the Wuhan Central Hospital. Now obviously, being an ophthalmologist, he deals with eyes and he would have seen lots of different patients on a daily basis. So something about these 7 patients that he saw concerned him enough to make him suspicious that something else was going on and a serious viral condition was going on. He had them scanned and had chest scans done on these individuals, and it turned out that they all had this kind of respiratory problem, which made him suspicious that this was SARS, and SARS stands for severe acute respiratory syndrome. It's also the virus that led to a global epidemic in 2003. And you know, so this was something that he really, I guess, had on his radar and he was concerned about, and he raised the alarm with, first of all, his colleagues. And essentially what he was saying to them was to make sure that they were, you know, taking the right precautions, wearing masks, and you know, really just being cautious of the virus that he was concerned was going to start to spread in a big way. Now sadly, Dr. Li went on to contract the coronavirus himself, and he'd been battling with it and been very ill with it, and on the 7th of February he passed away. So here on his Wikipedia page there's a bit more information on you know, his kind of work and his story around this virus and how he kind of effectively became a whistleblower for the virus. And here it's got a bit more information. So on the 8th of January he contracted the coronavirus himself, where he saw an infected patient in his hospital. Now the patient was suffering from a condition that we call acute angle closure glaucoma. So glaucoma is a condition, a very common condition around the world. It's a condition where you have raised pressure within your eyeball, and if left over time it causes damage to the retina and damage to your sight. But the most common type of glaucoma is what we call a primary open angle glaucoma. So these patients certainly this one of the patients he saw had acute angle closure glaucoma, and that's a different type of glaucoma. It's a lot less common, and you know, it may have been the case that, you know, all 7 of these patients had it, and maybe that kind of raised the alarm for him as well. Also, it seems like this individual was quite a young age, so it may have been something, the first instance, that seemed unusual, that he was getting this cluster of people who had this angle closure glaucoma, and along with their age, that would have been something that might have raised his suspicion enough to kind of do further tests. So just to touch on what angle closure glaucoma is it's a condition where the pressure rises very, very rapidly. It's very painful, so people who have angle closure glaucoma will usually come in because they're getting severe pain, and this pain is linked with when their pupils get bigger. So for example, in the dark, their pupils get bigger, and this closes the angle, and the angle is where the fluid at the front of the front chamber in the eye would normally circulate out. So if that fluid doesn't circulate out because it's blocked by when the iris enlarges or gets bigger, then they get a sudden spike in pressure, which causes a lot of pain in the eye. So these patients would have come in perhaps for that, and it seemed like they weren't showing any symptoms of fever at the time, but as it went on, so certainly the days after he saw them, as it highlights here, they started to develop fever. And it's at this point then that Li then began to suspect that these patients might have a corona type virus. So he went on to do chest scans on them, and it was confirmed that they had these chest infections, and further delving into it confirmed that these were cases of coronavirus. So another interesting fact was that his colleague does mention that most young people don't go on to develop severe condition as a result of having these viruses, but these glaucoma patients that Li saw on the 8th or this particular glaucoma patient was somebody who worked as a storekeeper in the seafood market, which is the point where they think this virus was first transmitted from animals to humans, and as a result this individual had quite a high viral load, so highly infected with this virus, and it's part of why these individuals then might have been vulnerable to having this type of glaucoma. For some reason it's kind of worked its way into the eye, possibly caused a condition that we call uveitis, which is an inflammatory condition in the eye, and it could have been what's led to them having this closed angle and raised pressure in the eye. So it may be that in situations where people have quite a mild exposure to the virus, they may not get eye problems like this. They may not get this angle closure glaucoma. They may get the mild symptoms, and they may get fever and things like that. But certainly in these individuals, which or might have come from this marketplace, the place of origin of the virus, then they had very high exposure, and that probably also made it more dangerous for the medical professionals working around them, and made it more likely that they would have caught a severe strain, or severe level rather of exposure to this virus, making it dangerous even for younger individuals who were previously very healthy. So coming over to another article in the South China Morning Post. So in this article we hear from another doctor called Dr Wang Guangfa, who is a respiratory specialist. So he deals with problems to do with kind of certain breathing conditions, which is obviously highly relevant in these type of viral conditions, because people get what we call upper respiratory tract infections, which leads to these breathing problems that's associated with mainly these viruses, coronaviruses, flu type viruses, influenza, etc. Now interestingly enough, this doctor tells the story of how he ended up getting the coronavirus as well, after going to visit some patients, and by this stage I guess the virus and the spread of the virus was already kind of noticed, and was already kind of being publicized. So he talks about how he was a bit confused initially about how he could have contracted the virus, given that he was wearing a protective mask to N95 level. So that's a type of mask kind of certified for hospital kind of grade use in these kind of environments where viruses may be around. But despite that, and despite taking all the precautions, he still contracted the coronavirus. And his conclusion was that he could really have only got it through infection via his eyes. And then he says after returning to Beijing, his left eye became red and he developed conjunctivitis. And 2 to 3 hours later, he started to come down with a fever and catarrh. And he said that initially he just thought it was flu because he hadn't seen any patients in the Wuhan region who had conjunctivitis. But anti-flu treatments didn't prove helpful at all, and the symptoms kind of went on. So he finally took a test, and it turned out that he did have the virus. So Dr. Wang then goes on to say that the most likely explanation he thinks for him contracting this virus would have been through his eyes and the fact that he wasn't wearing any eye protection. So we've had a look at Dr. Li, who sadly passed away, and also Dr. Guangfa, who recovered from the coronavirus. And he reports that he thinks that his transmission came about through his eyes. And again, with Dr. Li being an ophthalmologist and working around people who have eye problems, and he came in very close contact obviously with patients who appeared to be in the area of where this virus originated from. So what is this link between this virus and transmission through the eye? And once this virus is airborne through sneezing and coughing, then the soft tissues in your nose and your mouth are vulnerable spots where this virus then can kind of embed and start to cause you problems. And as a result, people obviously advising wearing masks, not to touch anything, etc. But the eye is often an area that people kind of overlook, and it may be that it's also very vulnerable to droplets. If these droplets get onto your eyelids, onto your conjunctiva in the air, then you would give access to this virus to kind of work its way into your body through the soft tissues of the conjunctiva and the kind of the skin around there as well. So theoretically then this could manifest itself in a form of conjunctivitis, and in severe cases then it may even progress to a uveitis, which is inflammation further within the eyes, and that can lead to then perhaps this type of angle closure glaucoma that we saw Dr. Li's patients were coming in with. Now that's probably going to be a very, very extreme situations, like these patients who were exposed in the marketplace where the first transmission from animals to humans was thought to happen, and these individuals had a lot of this virus in their body, and it may be in that situation then yes, you may be able to get this type of glaucoma, which then kind of really impacts people in the way that Dr. Li was seeing. So maybe that in normal exposure this is unlikely to happen and unlikely to progress to that far. Now obviously Dr. Li, being a young person himself, he must have been exposed to quite high levels of this virus, which meant that his whole body was quite overloaded by it and led to his sad death. So certainly to me it doesn't seem unreasonable that this virus, once it's airborne, can get onto your eyelids and your eyelashes and onto the soft tissue of the eyes, the conjunctiva, and lead to risk of it kind of working its way into your system, into your body, and into your respiratory tract through the conjunctiva, through the eyes. Of course, obviously the medical community aren't quite jumping to that conclusion, or at least people aren't saying that that's a major risk. It may be some kind of risk. That all point out that viruses that cause conjunctivitis aren't uncommon. In fact, anybody who's an ophthalmologist or an optometrist in training would certainly be aware of viral conditions that can cause quite severe conjunctivitis. The key one being the adenovirus and adenoviral conjunctivitis. So as a trainee optometrist, I still recall, even though it's been over 20 years now, being taught about the adenovirus and adenoviral conjunctivitis. because of the fact that, you know, it's really drummed into us that if you ever see a case of this in your practice, then you need to take, you know, serious urgent action straight away. So namely being able to kind of call ahead to the eye departments to make them aware that you're sending this patient over to them, so that they can make the necessary preparation to receive this patient. Then once this individual leaves your practice, then you have to sterilize all of your equipment, surfaces, you know, and as many areas of contact as possible, just because the adenovirus is notoriously very infectious, and you know, it's something that is taken very seriously. Now the adenovirus, much like the coronaviruses and influenza, etc., you know, all are viruses that you know, are around and cause people to have upper respiratory tract infections, etc. But you know, like with many of these viruses, they don't exist in one form. There are several mutations. So for example, the adenovirus itself, I know that there are at least 50 types of adenovirus. By the way, this new coronavirus, which has been given the title of 2019 novel coronavirus, it's called novel because of the fact that it has mutated to a new form that has not been seen before. As a result, while it's of the same family as other coronaviruses, this new mutation is an unknown entity. So there's lots about it that isn't understood yet. But it could easily be that it is now a strand that is, you know, able to kind of cause, you know, conjunctiva type inflammatory conditions, etc. So we just don't know all the full facts about it, and you know, more and more information is coming out about it on a daily basis. And when it comes to treating viruses, they're notoriously very difficult to deal with. So in the case of, for example, the adenoviral conjunctivitis, you can't use antibacterial eye drops on them. That just doesn't work. You can't use steroids on them. You know, so a lot of the conventional things that you can use for other conditions just won't work. So as a result, you know, when it comes to the general advice of cleaning your hands regularly, washing your hands regularly, then you may actually find that your bog standard antibacterial hand wash sanitizers, you know, may not always be effective enough when it comes to some of these more kind of aggressive viruses, etc. So you know, you might want to invest in, you know, some kind of medical grade, you know, hand sanitizers to use at home. So in the description box below, I've left an example for you to check out. It's what I use at home and what I would use in the clinical environment as well. So it's definitely worth having a look at something like that for your household and your family. So my peace of mind point for today is that, you know, while we talked about all of this and it all seems very gloomy, but the reality is that 99% of people who get even this coronavirus and this particular mutation of this coronavirus, 99% of people who get it, you know, will recover and won't have a problem at all. And it'll be mainly older people who might have other pre-existing conditions that will be more prone to more serious issues with this virus. The viruses like the coronavirus, generally the adenovirus, influenza virus, these are all viruses that have been around for a while and often contribute to us having problems like upper respiratory tract infections, things like that, and you know, common cold as well, flu. So these viruses aren't new. They aren't anything that, you know, is overly to worry about. You know, the main issue that's going on right now is containing this new mutation of this virus and stop it spreading to, you know, a wider population who don't have immunity for this virus. And you know, again, you know, with the numbers that we're talking about and the number of people who may be infected, again, because there's no vaccine for it at the moment, then you know, it's necessary for authorities to try and get as much of a grip of this as possible. So you know, it isn't anything to be overly panicked about, but you do need to practice the advised hygiene and advised you know, kind of precautions that will protect you and your family as best as possible. For my tip of the day, it is basically just to check out the links in the description box below, where I've left links to reputable organizations like the World Health Organization, the National Health Service, and the United Kingdom government recommendation on the coronavirus and hygiene, how to kind of look after yourself and your family, and practice good hygiene. So check that out. Just make sure that you're well informed. And then in addition, I'd just say, really, as far as eyes concerned, while people have got face masks on, depending where you are in the world, people aren't using gloves, so you still need to be very careful about rubbing your eyes and getting things on your eyes. If you're somebody who works directly with infected people, obviously it makes sense to wear glasses, and I believe that advice has now gone out. But for average person on the street, just be aware of your hands and be aware of rubbing your eyes. And again, just like you would in normal kind of virus, or conjunctivitis type advice, avoid sharing towels and things like that as much as possible, and anything where you can cross-contaminate. So my question for you today is, has this coronavirus affected you or anybody that you know close to you? Leave me a comment in the comment section below, and I'd love to read your feedback and your comments on this particular video. So take care, and I'll see you in the next video.